Welcome to the Banker Lamp. Please enjoy the video.
You arrive and must act now. First, keep yourself safe and quickly check if the person is responsive and breathing. If unresponsive or not breathing normally, call the emergency number immediately and begin speaking. Don't hang up. When the operator answers, state the exact location, floor, and nearest landmark so responders find you fast. Once done, follow any initial instructions and keep your phone line open. Make sure someone is flagged to meet the crew at the entrance. You must continue cooperating with dispatch, clearly answer questions, and implement the guidance they give because it tailors care until help arrives. If instructed, open the airway and check breathing. If not breathing normally, start CPR immediately, and if available, apply an AED following voice prompts. Control heavy bleeding with direct pressure and use a clean cloth or tourniquet only if trained. Also, make sure someone stays with the patient while another person flags incoming responders and retrieves emergency supplies. Once the ambulance arrives, step forward and give a focused handover. Age, chief complaint, time of collapse or injury, medications, allergies, and what you've done so far. This speeds clinical decisions. Then, clear the area so crews can work, move obstacles, and direct them to the patient's exact spot. If the primary number fails or there's no signal, use an alternate emergency line, send SMS if available, or ask a bystander to call. That troubleshooting ensures help is still on the way.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.